Patterns of behavior. A child with autism spectrum disorder may have limited or repetitive patterns of behavior, interests, or activities, including any of these signs. Performs repetitive movements such as rocking, spinning, or hand flapping. Performs activities that cause self-harm such as biting or head banging. Develops specific routines or rituals and becomes disturbed at the slightest change. Has problems with coordination or has odd movement patterns. Is fascinated by the details of an object such as spinning wheels of a toy car, but doesn't understand the overall purpose or function of the object. Is unusually sensitive to light, sound, or touch, yet may be indifferent to pain or temperature. Doesn't engage in imitative or make-believe play. Fixates on an object or activity without normal intensity of focus. Has specific food preferences such as eating only a few foods or refusing foods with a certain texture. As they mature, some children with autism spectrum disorder may become more and more engaged with others and show fewer disturbances in behavior. Some, usually those with the least severe problems, eventually may lead normal or near normal lives. Others, however, continue to have difficulty with language or social skills, and the teen years can bring worse behavioral and emotional problems. When to see a doctor? Babies develop at their own pace, and many don't follow exact timelines found in some parenting books. But children with autism spectrum disorder usually show some signs of delayed development before the age of 2 years. If you're concerned about your child's development or you suspect that your child may have autism spectrum disorder, discuss your concerns with your doctor. The symptoms associated with the disorder can also be linked to other developmental disorders. Signs of autism spectrum disorder often appear early in development when there are obvious delays in language skills and social interactions. Your doctor may recommend developmental tests to identify if your child has delays in cognitive, language, and social skills. If your child doesn't respond with a smile or happy expression by 6 months, doesn't mimic sounds or facial expressions by 9 months, doesn't babble or coo by 12 months, doesn't gesture by 14 months, doesn't say single words by 16 months, doesn't play make-believe or pretend by 18 months, doesn't say two-word phrase by 24 months, loses language skills or social skills at any age. Autism. Causes. Autism spectrum disorder has no single known cause. Given the complexity of the disorder and the fact that the symptoms and severity vary, there are probably many causes. Both genetics and environment may play a role. Genetics. Several different genes appear to be involved in autism spectrum disorder. For some children, autism spectrum disorder can be associated with a genetic disorder, such as the Rett syndrome or Fragile X syndrome. For other children, genetic changes may increase the risk of autism spectrum disorder. Still, other genes may affect brain development or the way that the brain cells communicate, or they may determine the severity of the symptoms. Some genetic mutations seem to be inherited, while others occur spontaneously. Environmental factors. Researchers are continuously exploring whether factors such as viral infections, medications, or complications during pregnancy or air pollutants play a role in triggering autism spectrum disorder. No link between vaccines and autism spectrum disorder. One of the greatest controversies in autism spectrum disorder centers on whether the link exists between the disorder and childhood vaccines. Despite extensive research, no reliable study has shown a link between autism spectrum disorder and any vaccines. In fact, the original study that ignited the debate years ago has been retracted due to poor design and questionable research methods. Avoiding childhood vaccinations can place your child and others in dangers of catching and spreading serious diseases, including whooping cough, measles, or mumps. Risk factors. The number of